My name is Dr. Paul Mary, and I'm the medical director and founder of Ethos Wellness Center here in Oklahoma City. We'll be opening in January, and we'll be providing an array of different services and therapies, basically between Edmond and Oklahoma City. So personally, I've been on a longer-term quest to find some alternative practices, medications, and therapies to address underlying issues of disease and aging. The medical schooling curriculum was mostly focused on mitigation of symptoms, and so you pretty early on in your medical training realize that the majority of the services that physicians provide in the conventional allopathic Western medical sphere really don't address the root cause, the underlying issue making people diabetic or making people hypertensive or giving them neurologic dysfunctions. So a personal passion of mine has been to figure out what contribution lifestyle, what contribution diet, and what therapies we can implement to try and reduce some of these progressive diseases that impact our quality of life and obviously as well our life expectancy. So at Ethos, we're going to be combining a lot of the modalities that have been shown to be promising in other health and wellness spaces across the country and world. And that's going to be a combination of, just a dedicated contrast studio for people who want to just explore, the heat and the cold, improving their immune system, improving their autonomic nervous system, improving their mood. The heat shock proteins, the cold shock proteins are anti-inflammatory. People feel incredible after they finish an ice bath and a sauna. And then you can finish up as well in that same space with photobiomodulation. So that's the red light therapy I'm sure so many people have heard things about. And so there'll be a couple of dedicated red light therapy bays for people to just kind of soak in after they finish their contrast session. On the medical side, we're going to be offering IV therapies for people, and those are very important for a lot of the issues that the modern diet kind of gives us when it comes to processed foods, and even just like the best case scenario, if you're doing everything you can and you're eating organic and you're trying to make sure you're staying away from preservatives and chemicals, the food that we're eating now is just not as nutrient dense as it used to be. So there's a very important space for IV therapies to try and supplement some of the deficits that we're finding in our diets, especially for high-performing individuals who like to stay active, or for people who have chronic medical conditions. This may be a huge bump in their health and wellness experience by helping their body to heal itself. We'll also be offering PEMF chairs. So this is pulse electromagnetic frequency is a modality that the orthopedic literature, the space program with NASA has studied to show that there's benefits in wound healing and anti-inflammation. So this will be kind of stacked along with our IV therapies for our patients. We're going to be offering stem cell derived exosome therapies, which are very promising in helping to heal any kind of physical injury, or even just to revitalize the body's natural healing process and immune system. We'll also offer peptide therapies, which are going to be addressing a whole host of different dysfunction as far as, diabetes, heart disease, neurologic dysfunction, and then just, again, regeneration. We'll also offer the hormone optimization therapy for people who need, obviously to address some of the background testosterone levels and things that are maybe not up to the same levels they were when they were in their youth, or before maybe certain diseases or dysfunction entered their health experience. Contrast therapy is an opportunity for your body to be challenged. The word that most people like to use is hormesis. So essentially the idea behind that is just like any other type of physical activity that's strenuous, that initial insult to your body, whether it's through a weightlifting routine or through a run, it's going to be difficult, it's going to cause a stress, but the response your body makes is going to be to increase the capacity of the body to lift more weight, or to run further, or for the heart to be kind of improved in its ability to pump blood. So hormesis in this regard for a contrast session is actually challenging your autonomic nervous system. So the background nervous system that works to regulate your heart rate, your blood pressure, the digestion of food, there is a scarcity of actual stress because we live in such a comfortable modern experience of life. Most people live in, climate controlled buildings, then they go to work in climate controlled buildings, and they drive their car in a climate controlled center. So while it's very comfortable to live in a thermoregulated 7-degree environment all night when you're sleeping, all day when you're working, and even when you're driving back and forth to where you need to go, unfortunately, that comfort does have a negative consequence whereby the autonomic nervous system atrophies to an extent and is no longer able to be resilient in the face of extremes of cold and extremes of heat. Now, that would not necessarily be a bad thing if it also didn't come with consequences when it is involving mood disorders and when it also is not helping to firm up some of the responses of the immune system in those settings. So the benefits of contrast therapy are extremely wide and multifactorial. So we're going to have not only an improvement in mood, which I think is the most gratifying component whenever someone's finished with their session, but you'll also be able to firm up your immune system by actually improving the function of your white blood cells, of your antibody profile, and then you'll also be releasing cold shock proteins from the liver and heat shock proteins, which are both going to decrease inflammation, improve wound healing, and over time, that chronic atrophy of the autonomic nervous system can be reversed, and you can actually revitalize your ability to regulate. And this all goes back to a lot of information that they're coming out with at the moment in regards to the vagus nerve and kind of the autonomic tone that a lot of people are living with on a day-to-day. Unfortunately, because of that comfort and because of the lack of participation that your autonomic nervous system faces in addressing stresses and in addressing some of the kind of functions of daily life, there is disorder where the sympathetic nervous system tone increases, and a lot of people experience anxiety, they experience depression because there isn't the natural ebb and flow of rest and stress.